Something happened. A top Democratic staffer crunching the numbers on health care, admitting just today that the tax on generous health care plans won't only hit folks under 250 grand, try under 200 grand as well. House Minority Leader John Boehner says he's not surprised.
Well, I think it's pretty clear that these people are going to pay higher taxes as a result of the policy that's there. And it's not just that one issue. When you look at the mandate on individuals to buy health insurance, if you don't buy it, it's a $3,800 tax. And so there's going to be a lot of lower middle class and middle class people who are going to get stuck with this big tax increase.
What about this issue that the CBO raised yesterday, Congressman, that a lot of folks' benefits, particularly those of Medicare Advantage, will be cut under these reform efforts? The Vice President today on the stump saying that it's not the case, trying to assure seniors that they needn't worry about that. But how big a deal is this now?
Well, there's this difference in what the President and the Vice President say they want and what these bills moving through Congress actually say. And it's pretty clear that if you look at the $500 billion worth of Medicare cuts, the Congressional Budget Office made it clear this will result in less services for seniors. And when you look at the up to 6 million American seniors who are on Medicare Advantage, it's pretty clear that their program is going to be gone. And so this is going to affect seniors. And then to have the Medicare folks downtown Washington telling the seniors, well, you shouldn't be getting this mail from your insurer saying that there are going to be cuts, because it's really not true, except it is true.
What, do you know where those, that it was really started with going after Humana, the big private insurance company, that had effectively told its customers that was a genuine fear. And I think they were looking at sending everyone with the dogs and the IRS out on the company. Do you know where that stands right now?
Well, I suspect it's still underway. But it's really rather interesting. The Medicare folks here in Washington didn't say anything to AARP, who went out to their members, and they're one of the biggest sellers of Medicare Advantage, saying that the president's plan was a good plan. They ought to support it. And so we've got a double standard here, and I just don't think that the bureaucrats here in Washington ought to be controlling what these outside organizations say in any way, shape, or form.
In the meantime, Congressman, you're closer to the fire than I am, but I mean, I get a sense that there is a rush on the part of the Democratic leadership to get something voted on, and soon Nancy Pelosi has apparently shot down something that you've signed on to, which would be a bipartisan sort of a discharge position that the public gets to see 72 hours in advance what effectively are talking about and ultimately voting on. So when it comes to health care, what are you sensing among what the leadership wants to do and what it doesn't want to do?
Well, first, if there's going to be a bill, members of Congress ought to have 72 hours to look at this bill and to read it. And the American people ought to have 72 hours to look at it and to help try to digest it. Secondly, I don't see how they're going to bring a bill out when they're dishing the concerns of moderate to conservative Democrats. They're ignoring Republicans. That means this bill is going to move to the left. It means it's going to be more expensive. It's going to have more impact on the deficit. It's going to have higher taxes. And I don't know where there are 218 votes here in the House to pass such a bill.
You're a pretty good number counter. Are you saying then that there are enough Democrats in the House to vote against this to ensure that it doesn't pass in the House?
Today, that would be correct. I don't think they have the votes, and I don't think they're going to get the votes for this left-wing big government plan that they want to shut down the throats of the American people. This isn't going to happen.
Well, how serious did the CBO report last night for the budget chief on this whole Medicare situation change the dynamics, or did it? It didn't get much official coverage in the mainstream media, the Democratic leadership really not discussing it much. What do you make of that?
Well, I think it's having a lot of impact on members themselves. You got members who really have doubts about the government option, doubts about how they're going to pay for this, doubts about how it's going to affect the deficit. And then now they're going to have more doubts about how many Americans are going to be charged higher taxes that make less than $250,000, breaking the president's pledge. There are enough doubts here that if they can get to 218, I want to see it.
All right, the argument has been, Congressman, that better a crippled bad package, those are my words here to simplify it, than none at all, that they don't want to make the mistake that Bill Clinton did, or they figured that Bill Clinton did in 1993, where nothing essentially came to the floor, and it was just all hell breaking loose for Democrats. Then the House turned and all that. They thought they could have mitigated that then had they voted on something even much smaller then, so they're going to do that now. What is the likelihood of success with a smaller, something that tickers around the edges package?
Well, there's been no indication that Democrat leaders in the House or Senate or the White House are moving in that direction. They're still moving in the direction of this big government plan, high taxes, and big deficits. At some point, it's going to become clear that this can't pass. I don't know whether that's 3 weeks from now, 4 weeks from now, 6 weeks from now, but at some point, it's going to become clear. And then they're going to have to make a decision. Do they accept the defeat, or do they hit the reset button and scrap all these big government ideas and work with Republicans to make our current system work better? There are things that we can do, whether it's portability of insurance from job to job, whether it's dealing with those with pre-existing conditions, dealing with tort reform and defensive medicine that drives up the cost of health care. There are a lot of things that we can do to make the current system work better, and that's the only thing, in my view, that has any chance of passing the Congress this year.
Democratic leaders have been saying, Congressman, that Republicans who say scratch and start fresh know very well that scratch means scratch, period. It ain't going to happen. And that is really what you want, nothing to happen. What do you say?
That's absolutely not true, Neil. There's no debate here in Washington anymore, or around the country, that our current system needs some improvement. It needs to work better for more Americans. And we need to do things to bring down the cost of health care in America. And so Republicans have been reaching out to the White House and to our Democrat colleagues for 6 months. And yet all we've done is gotten a letter saying thanks, but no thanks.
Let me ask you, in the middle of this, Congressman Joe Wilson has been sort of like the whipping boy in the Party of Democrats and punished on the floor of the House, censored, whatever you call it, reprimanded. He is now apparently the target of Democrats in the next midterm elections. Would you campaign for him in his state?
Absolutely. Listen, Joe admitted that he made a mistake. That's why he called the president and apologized about it. And I was very happy that the president was gracious enough to accept his apology. Joe Wilson's a good member of Congress, a really decent guy and well-liked by members on both sides of the political aisle. And they can make a target out of him. I understand that. He made the mistake. But he's a good member in a good district, and he'll be back.
Congressman, thank you very, very much. Good having you.
Thank you.